Hello and welcome back to the Digital Health and Wearables series. Today I have another magnificent guest and episode for you. But before I go ahead, let me remind you to subscribe and share all this magnificent content with your communities and with your contacts in healthcare. Also, let me acknowledge our industry partner, the Healthcare Partnership, and our global partner, Spirit Digital. But gives me great pleasure this week to introduce Zipporah Iregi. She is a registered nurse in Kenya, and today we're going to talk about nursing leadership. Zipporah, how are you?
I am very fine, thank you. Thank you so much for having me on this platform, and I'm really excited to have this conversation with you today. Thank you.
We are delighted to have you here. Thank you so much for accepting the invite. And I've been following some of your great work, and we met in Barcelona. It was fantastic.
Well, thank you, and it was lovely to meet you. I hope we shall meet again soon.
Yeah. I'm going to go straight to the questions. Is that okay?
Yes, that's fine with me. Thank you.
Brilliant. So, the first question that I have for you is what's the importance of nursing leadership and mentoring?
Um, Thank you very much for that question. I think I have thought a lot about that question, even as I was starting my leadership journey. But why nursing leadership is important is because a nurse is at every level of healthcare. She's the first, he or she is the first person that a patient meets up until they are let out of hospital and throughout their entire care plan. So, what nurses have is a unique perspective into the healthcare system, a unique position into what the healthcare system needs. And statistics show that nurses make 59% of the workforce. So, with this knowledge in mind, then nurses should be involved in leadership because they are at the right position. They have the right expertise to drive healthcare into the future and to make sure that we have a better and safer and secure health for every individual in the world. And that is why healthcare leadership is important to involve nurses in it. Yes, thank you.
That's a fantastic insight. So, nurses, of course, they are crucial for the delivery of healthcare, but also they know the healthcare system really well because it's a day to day activity. Fantastic insight. Thank you so much. Okay, going to the second question. Um, what have you learned from the pandemic in terms of with regards to nursing leadership?
Um, First of all, the pandemic was very scary for us, especially because we were then pulled out of our normal working situations and we had to work in the isolation centers. And as you know, as it began, it was really scary because we couldn't meet our families, we couldn't socialize with people anymore. We had to work maybe for 2 weeks and then go for 2 weeks isolation. It was very scary. But I think over the days, what we have learned about nurses is that they can step up and be creative and adaptive to such situations. And even as there was a fight to get more PPEs or to get more staff in the hospitals, nurses were able to step up and actually put in the work, put in the hours, and do the work to ensure that every person was taken care of, even in a scary situation. So, even as you're talking about the topic of nursing leadership and what we have learned in the through the COVID pandemic, sorry, then we have learned that nurses are very vital. We cannot continue to ignore the role they play in ensuring that everyone receives the care they need. Um, and so, when it comes to the question of nursing leadership through the pandemic, then this only amplified the need to involve more nurses. From the junior levels to the highest levels of policy making, nurses need to be involved in these decisions because, like I said earlier, the unique perspective they bring gives them a very unique niche to ensure that even as we are facing pandemics in the future, and God forbid that that happens, that people will receive the care they need, that nurses are able to drive that agenda to ensure that health care is only improved day by day. Yes.
Fantastic. Thank you so much. And also, I think is a very is a learning curve here for us in the healthcare system because nurses represent a very important stakeholder. We always think about the doctors, the governments, but nurses have that unique perspective, as you mentioned again. So thank you so much. The
Thank
third question is, how does nursing leadership look like for you?
Oh, that is not an easy question. I think as I was beginning my leadership journey, I thought with beyond any reasonable doubt that nursing leadership um, is about having that title of chief nursing officer of a particular hospital or ward manager or the how do I put this, the national coordinator of nursing services in the country. But as I have grown in my journey, I have realized that nursing leadership involves the character of nurses and who they are to the core. It's about them being empowered and trained to be advocates of care, not just at the national levels or global levels, but even in their families, in their communities. And that is how nursing leadership looks like to me. It's nurses, both student nurses, qualified nurses, and of course, even those who have retired, being empowered and being given the necessary skill sets to be advocates for change and drivers for change, not only at the highest levels at the table of policy making, but even in the little situations where they work in their communities and in their families. And of course, also being at the big tables is very important. Yes, thank you.
Oh, fantastic. I mean, as you mentioned, advocates for change and advocates for health and to implement change in their communities, in their homes, in their workplaces, and everything. So they always carrying this kind of mission. That's very, very impressive and really important. So, and the fourth and last question that I have for you, Zipporah, is how can nurses and midwives forge the future of healthcare?
Pardon,
Uh,
can you please repeat the question?
how can nurses and midwives forge the future of healthcare?
How can we forge the future of healthcare? Um, there's a program I've been involved in that is called the Nursing Now campaign. And that was a campaign launched in 2018 where we were lobbying to raise the profile and status of nursing. And one of the core factors that was happening in that was student mentorship. And I think how we can forge the future of health is by beginning to train um, these young leaders from when they are being forged, rather when they are being trained to start their professions as nurses, as midwives moving forward. Because now what happens is that even as a student, then these nurses are given the necessary skill set to, like I said, be advocates for change, but not just that, but be creative and adaptive in the way they think, in the way they value information, in the way they value people in provision of care. And slowly by slowly, once we start changing these attitudes of nurses and midwives from the very grassroots of their training, then as they grow in their professions, as they continue to meet people, as they continue to provide care, then they will do so with a knowledge of what is at stake, of what a secure future for health looks like. And little by little, then we continue forging an even brighter and better future for health. So I think it starts from the very least level. The young nurses who are being trained, the young midwives who are being trained, and not just that, even I think for all healthcare professionals, if we start changing their attitudes and show them the potential they have to do much, and the potential they have to cause change in their communities, then we will continue now building a better and secure future for health. Yes.
Oh, fantastic. That's a really great insight. You mentioned such an important point there about educating them and train them very early on, like a very at the very beginning from the studies, from the education. With what we
Yeah.
usually see is like trying to develop professionals at mid of their career, isn't it? Try to make them better, and
Yeah.
that initial stage is really, really important. Fantastic point.
Yes.
Zipporah, I want to thank you for your time, for your expertise, your magnificent work. You are a true leader. I'm a new fan, if you like. But also, and I finish all my episodes with a peculiar way. It's not really a question as such. It's
Yes.
called 1 minute of fame, and you can mention anything, your work in the community, you can mention family, you can mention your achievements, you can mention anything whatsoever to round up. Over to you. 1 minute of fame.
Oh my goodness, I was definitely not prepared for this. Um, 1 minute of fame. Oh, you have put me in a very anyway, 1 minute of fame. So um like I said, my name is Zipporah. I am a young nurse in Kenya. And I have been working as an intern for the last 2 years. And I think what I enjoyed most in that period was working with student nurses because I was able to be part of a program for mentoring young nurses in Kenya, and that has opened doors for me to even speak at the President Joe Biden's COVID summit units, and that was like a highlight for me. But I think what I appreciate most is that I have grown in the process, and getting to meet people like you has been such a wonderful opportunity for me. And I just want to thank you for having me here. Thank you. I hope I answered that correctly.
No, that's fantastic. Your work is really great, and you are a true inspiration. And we need more leaders and more people to kind of expose these agendas and the reality on the ground. So thank you so much. So it's nice to
Thank you.
see you.
Nice to see you. Thank you very much for having me here.
Great. I'm going to round up now. So, to all our viewers and listeners, make sure you subscribe to the channel. Acknowledge our partners again, the industry partner, the healthcare partnership, and the global partner, Spirit Digital. Also, make sure you connect with the truly inspiring Zipporah. I'm going to put our LinkedIn here and our Twitter. Make sure you connect with her, ask her questions about her work, and follow her. And I'll see you all next week.